Welcome everyone to BayCare Presents. I'm excited today to have Dr. Jenkins with us. She is a family medicine physician and she has a passion for teaching. She is part of the residency program that we have with USF over at Turley. If you were on the call earlier, you heard us kind of discussing that. And I think her energy and her passion about sharing knowledge with individuals is really what drew me to ask her if she would come be one of our presenters. And she has so much great information to take. We were talking about how you'll probably want to go back and rewatch this. So I am going to just go ahead and turn it over to you, Dr. Jenkins, so that you can share your wisdom.
Thank you so much. I'm Dr. Jenkins. I'm a family physician. I'm also board certified in lifestyle medicine. And I do see patients at the Turley Family Health Center, but my primary role is training the next generation of primary care doctors. And, it's a blessing because it really helps me to know the latest and the best evidence-based recommendations for patients to feel better. So today we're going to talk about what Dr. Google can't tell you, or Dr. ChatGPT or Dr. TikTok. So this is specifically going to be about weight loss and heart health. And I know that's kind of a lot, but I'm going to do my best to give you the pearls, and we're going to try to keep it in that 30-minute time frame. So let me just get to the next slide. So what is the premise of this talk is partnering with your kind of trusted health professionals, because I think a lot of us, look at social media and Google and other places on the internet when we're worried about our health. It's very common for us to turn to the internet to try and, help us better understand how to prevent disease or treat disease. And you really do have to be very careful when you're looking at that information because, as many of you have probably encountered, like some of those sources of information may be very helpful, and some of those resources may not be very helpful. So we're going to talk about some of the evidence-based things as it relates to weight and heart health. And, what are some of the myths? Like, what are some of the common myths that are out there that you might encounter when you're Googling things? So, weight loss, right? This is something that a lot of us struggle with. And if you say, Dr. Google, what is the most effective way for me to lose weight? It's going to tell you to combine a healthy diet with regular physical activity. You want to try to lose 1 or 2 pounds a week, and that's going to result in long-term weight loss. But I find that many of my patients, their weight struggles, it's not because you don't know some of the basic premise of how to lose weight. It's implementing it. It's knowing the details. And so if you Google what is a healthy diet, you'll read information about kind of a Mediterranean type diet, lots of healthy fruits and vegetables, whole grains. We're going to talk a little bit about that. Healthy sources of protein like chicken and pork and fish, and then limiting processed foods. And we're going to talk about why added sugars and processed foods and saturated fats might be derailing your efforts to have a healthy weight. So I'm going to start with an example. I feel like some of us are kind of trained to look for certain words when we're trying to get food and we're trying to lose weight. So we're going to look for low sugar, low carb. You might see the words keto or paleo or low, all these different terminologies. So, for example, the Atkins bar has 7 grams of protein and 3 grams of net carbs. But when you go to the far right, and you look at the ingredients list, you're seeing a lot of terms that sound like chemistry, that aren't necessarily easy to understand what they are. So I circled 3 of those words because maltitol, polydextrose, and sucralose are what we call sugar alcohols. And a lot of food products that are marketed as weight loss products will include these sugar alcohols because they have less, sugar, like less of an impact on your insulin, but they're not necessarily without risk. So you have to be really careful about these sugar alcohols. So those were a few of them. Other names might be things like xylitol, which you can find in chewing gum. So these sugar alcohols, they may not cause a big spike in your blood sugar level like regular sugar might, but the problem is your microbiome in your gut, when you digest these sugar alcohols, the bad bacteria in our gut will eat up these sugar alcohols and cause a lot of bloating and inflammation. So, for example, people that have irritable bowel symptoms or digestive symptoms, and they chew sugar, the xylitol, sugar alcohol, and chewing gum, they'll notice that their symptoms are worse. So, inflammation, although it's not the same effect as regular sugar, these sugar alcohols causing a lot of inflammation can make you feel tired and achy, can cause water retention and bloating, make you feel sluggish. And then these sugar alcohols are very, very sweet. So even though they don't spike your sugar in your blood as much, it trains you to be used to very sweet foods, which then can lead to you eating other sweet foods. So the sugar alcohols are not necessarily a healthier substitute than things like regular sugar and molasses and honey. If you are going to use some of these artificial sweeteners, it's better to use, sorry, I shouldn't use artificial, but sugar alternatives. It's better to get things that are more from nature. So you could try things like monk fruit or coconut sugar or stevia from the stevia plant. And just a tip with stevia, I have a lot of patients that'll use Truvia. Truvia has stevia plus a sugar alcohol. So it's not as healthy as stevia. And a lot of people, even though stevia is healthier, still have digestive issues with stevia. So you just have to kind of be careful about that. The other concept with sweeteners is not just whether it's artificial or natural, but what it does to your blood sugar. Because when it raises your blood sugar higher than the 50s, your body starts to release a lot of insulin. And when you're trying to lose weight, having big spikes in your insulin really is the enemy. So when your body has a lot of sugar coming in and it releases a lot of insulin, a lot of that sugar is going to be then immediately shifted to fat cells and promote weight gain. So we use this term called glycemic index. It basically means how high does your sugar go when you eat certain foods. So any food with a glycemic index above 50s is going to potentially lead to more weight gain. And foods that have a lower glycemic index are going to be less likely to spike insulin and cause weight gain. So you can see in the examples, they're on the slide, things like agave, which is a natural sweetener, has a low glycemic index, and that may be a very healthier, a much healthier choice. Whereas at the very bottom, high fructose corn syrup, which is in many, many, many of the products that people eat on a regular basis, it has a very high glycemic index. And that's why people that have high fructose corn syrup in their diet will have a lot of weight gain. So these are just examples of things that you might want to look at. So sweetening your baked goods with dates or agave or stevia is going to have less of an impact on your weight than if you're using molasses or honey or white sugar or high fructose corn syrup. So then we used this word inflammation. And then if you Google, Dr. Google, how does inflammation impact my weight? It'll tell you that anything that causes inflammation is going to disrupt your metabolism. So what does that do? It makes you hungrier. It makes it difficult to burn fat because when your metabolism is slower, you're going to kind of go into this storage mode. So it's not just about the calories. Like if you look at the foods on the left that are very processed and have a lot of additives and are very artificial, you can tell they're kind of artificial from the type of colors that you're seeing. Those are the type of foods that are your body is going to not necessarily recognize as food, and they're very inflammatory. Whereas if you look at the foods on the right hand side, that just looks healthier, right? Those colors are more natural colors. Those you're seeing less packaging and processing that goes into those food products. So more natural foods or whole foods are going to lower inflammation and cause less inflammation. So it's a really important concept because I like to tell patients like it's when you're eating an apple versus when you're having a bagel. So your body, a lot of our immune system is in our stomach. And when you eat something, your body has to decide, is that food and is this healthy for me? Or is this a disease? Could this be food poisoning or some kind of infection or parasite that I need to fight off? So a lot of our immune system is in our gut. And when you eat a bagel, which has a lot of chemical additives, your body does not recognize it as food. So it immediately starts sending white blood cells and chemical mediators that cause this kind of like attacking inflammatory response that is not because you're sick, it's because you're eating processed foods. So it's really, really important that you understand that concept and how it's not just about the calories. And just to kind of go over a few more things about, different contributors to why we gain weight. So again, just eating foods high in sugar and processed carbohydrates, they increase this hormone in your brain called dopamine. And dopamine is also the hormone that makes us like gamble too much or makes us addicted to certain other things like alcohol and tobacco. It's kind of our pleasure hormone. So if you're eating a lot of foods that cause this dopamine release, it makes you want another dopamine release. So you get kind of addicted to those kind of foods. Saturated fats also do the same thing. They're very addictive kind of foods. People also will have issues when they're under stress where they emotionally eat. So, when we're stressed out, I don't know a lot of patients that crave a kale salad. Usually when we're under a lot of stress, we crave mac and cheese or a bowl of ice cream. So you have to kind of look at those emotional triggers for why we eat certain ways. And there's a very good organization called Overeaters Anonymous, which is www.oa.org, that talks about that emotional eating. And also, just when you're trying to make changes in your diet, understanding that habits are important and partnering with your healthcare providers to understand how do you change habits. Like some of us are just in the habit of making a bagel for breakfast or getting an egg McMuffin from McDonald's because it's quick and that's what we're used to doing. So you have to kind of talk to your dietitian or your healthcare providers or your healthcare professionals about how do you make meaningful, lasting changes. And then lastly, because your brain gets used to these kind of foods, you can actually have a withdrawal when you start to cut back on sugar or processed carbohydrates. So it's also important to prepare for that. You may have heard of that concept when people have done the keto diet and they talk about the keto flu, where you feel just lethargic and achy and mentally foggy. So, ways to prevent that is to make gradual changes, to drink lots of water as you're kind of transitioning to a healthier diet, and then try to eat plenty of healthy proteins and healthy fats, which will help stabilize your sugar and your insulin levels so that you don't have as much of a crash. So I just wanted to debunk a couple more of these myths that are commonly out there on the internet. You'll see with certain diets that they kind of demonize carbohydrates and even fruits. Not all carbs are bad. We actually need carbohydrates as part of a balanced diet, but there are good carbs and bad carbs. So we'll talk a little bit about that, but not all carbs are equal. The other myth is that a calorie in is a calorie out. So if you're trying to lose weight, you just need to eat less and exercise more to burn off calories. And unfortunately, it's just not that simple because the apple calories and the bagel calories are going to send very different signals to your body. It's going to have a very different response for inflammation and insulin. And so it's important that we understand that a calorie is not a calorie, although that is part of how people are successful in losing weight. So exercise is important for health reasons, for a lot of reasons, but it's not enough to lose weight. So when we're talking to people about obesity and trying to lose weight, really it's about almost 90% dietary things that you have to look at. And then the other 10% is exercise. So exercise does help burn calories even at rest. And it's good that you'll sleep better and you'll feel better and you'll have better motivation and less depression. But you cannot out exercise a bad diet, as we say. And the other crucial thing in your life that will affect your weight is sleep. So this is showing you that there was a research study done on 1,000 patients that instead of 8 hours sleep, they had 5 hours sleep. And those patients had a higher body mass index, which is a way of us describing your weight. It's your weight and your height. So these patients had a higher body mass index of about 3.6%. So why that is because when you don't get enough sleep, your body releases more of a hormone called ghrelin that makes you hungrier, and less of a hormone called leptin, which makes you feel satisfied. So most adults should be aiming for 7 to 8 hours of sleep, and kids even need more sleep than that. Kids should get 9 hours or more of sleep a lot of times. So you're hearing me talk about diet and exercise and sleep. A lot of healthcare providers, physicians and nurse practitioners and dietitians and physical therapists are training in what we call lifestyle medicine. So we recognize that there's a lot of factors in your life and in the decisions that you make every day and the type of habits that you have that have a significant impact on your health. So I also just wanted to just mention very briefly, having friendships and community and social connection is very important for any healthcare condition. Avoiding smoking and excessive alcohol use and illicit substances, and also just looking at the stress in your life and how you're managing that. So lastly, when we're talking about weight, and then we're going to kind of transition to our next subject is, of course, there's lots of other tools that providers will have in their toolbox to help you lose weight. So it's really important that you find a provider that's either obesity medicine certified or lifestyle medicine certified or has a level of comfort with these other options. So we do have medications. These have become quite popular because we have a new class of medications like Wegovy and Manjaro and these injectable medications that have been a lot more successful in helping people lose weight than medications that we had in the past. But it's also important for your healthcare provider and not somebody off the internet or that isn't well trained in this to talk to you about all the other factors that contribute to weight, because hormones can affect your weight, thyroid conditions, certain prescription medications that you're taking. So all of that needs to be discussed. There is also bariatric surgery, which can be another option. And then again, just really having somebody that you can talk to that's well versed in all these options, because even those new medications can have significant risk and shouldn't be used in certain populations. So really making sure you're talking to somebody that you trust. All right. So that was kind of a whirlwind of talking about obesity and weight issues. So now we're going to talk about heart health, which is also very, very important. So I'm hoping to talk about a heart healthy diet, how we can do a better job detecting whether or not you're at risk for heart disease, talking about what might be in your family history that would be important to know as it relates to heart disease. And then we'll try to talk about why not everybody is the same in their journey in helping to prevent heart disease and treat heart disease. And we really have to tailor these plans to the individual. So what is a heart healthy diet? I'm going to start by telling you some examples of what is not heart healthy. So, it's very frustrating for patients to know what is heart healthy just by looking at labels. Unfortunately, food marketing can be very confusing. So, for example, if you look at a box of Lucky Charms, it says in very big letters, whole grains. What's really frustrating is there probably is a tiny amount of whole grains, maybe 1% or less. And the rest of that cereal is refined grains and a lot of additives and sugar. So that is not, despite the marketing, is not a healthy source of whole grains. The same with breads, even if they have on the main packaging wheat or multigrain, a lot of that is not whole grains. A lot of that is refined grains with added sodium and sugar. Fat-free salad dressings, it's kind of the same thing where it may be low in fats, but it's very high in salt and sodium and artificial ingredients that promote inflammation. And then getting back to this reduced fat or low fat, when they take fat out of a product like peanut butter, like Skippy, they add a lot of sugar to it and it may have less protein. So it may not be as healthy as just having the natural peanut butter with no additives in it. So this is a really important concept. What is a whole grain? When you're looking at your products and it talks about wheat, if it's not a whole grain, then it's a white grain. So flour is an example of a white grain. When they make flour to put in different products, what they're doing is removing portions of the grain. So a whole grain has bran, which is the covering of the grain, and that's where it has a lot of the B vitamins, a lot of the fiber, which is going to make you feel full and feed your good bacteria, and has a lot of like cancer prevention properties and anti-inflammatory properties. When they make flour, they also remove the germ. So the germ that is part of the whole grain is removing a lot of antioxidants and vitamins and healthy fats. So what you're left with when we make enriched flour or white rice or a refined grain is just the endosperm, which is mostly carbohydrates, and strips kind of the rest of it away. So what are examples? Like these refined grains that are not whole grains are like your all-purpose flour or white rice or cream of wheat. So this is showing you replacements where instead of doing your all-purpose flour, you can look for whole wheat flour. Or instead of white rice, you can look for brown rice. Instead of cream of wheat, you can do oatmeal or oats, which is whole grain that doesn't have added sugar. You can do, instead of your de-germed, so now you're going to know what that de-germed term means. Instead of de-germed corn flour, you would do whole grain cornmeal. So again, this is really just to show you how tricky the marketing can be with breads. You want to look for the terms whole grains or 100% whole grain. So again, this multigrain bread or honey wheat bread that has the refined grains mostly. If you look at the first ingredient for this bread, it's unbleached enriched flour along with honey and sugar and other kind of additives. So you just have to really be careful about looking at labels and making sure that it is truly a whole grain. Another big myth that is really important to talk about when you're at risk for heart disease or you're trying to prevent heart disease is this idea that people get high cholesterol from eating too much cholesterol. We know through a lot of good research that that is not what causes heart disease. So cholesterol in your diet is not necessarily what causes you to have cholesterol build up in your arteries. And we're going to kind of talk about this concept. But your dietary cholesterol is a very small factor when it comes to how much cholesterol you build up in your arteries that may lead to a heart attack or stroke. So this a lot of times is very encouraging for patients because when you're trying to eat more proteins and healthy fats and reduce processed foods, you have to eat something. So, I tell patients it's okay to have eggs, it's okay to have avocados, and these are foods that they may have steered away from because of the cholesterol content. So this, I promise, is the only slide that is this complicated, but it's really to show you that heart disease is a combination of two things. When your liver is packaging cholesterol for your other organs, because cholesterol is very important to our organs and our cells and has important functions in the body, your liver is going to send cholesterol in these yellow spheres. So if your body has a lot of small spheres, then it may go to the wrong place. These little yellow spheres may actually cross into the walls of your arteries and build up as plaque, which they then may cause a heart attack or a stroke at some point. So if you're just getting your blood work and you're looking at your LDL cholesterol level, so LDL cholesterol is usually what we call the bad cholesterol. It may not be telling you if you're having a lot of these small yellow spheres that are traveling around carrying your cholesterol. So there is a lab test that the American College of Cardiology and the American Heart Association and the National Lipid Association has been encouraging for certain patients that measures the number of these particles that might be putting you at higher risk than we think. So it's the name of this lab test is called apolipoprotein B. And this is something that you want to make sure if you're if you have obesity or prediabetes or a strong family history of heart disease, and you're not obviously at risk for other reasons, like having a high blood pressure or you're smoking or diabetes, you may want to have this test added to your other cholesterol tests, which is going to give your healthcare provider more information about your risk. But I also wanted to show this slide because heart disease also comes from things that damage the wall of your arteries. So it's not just about cholesterol. Having a healthy blood pressure, avoiding smoking, really working towards not having diabetes or having your diabetes under control is really, really important for reducing your heart disease risk. So this is just to show you the impact that a heart healthy diet can have on an artery. This was a research study done by Dr. Caldwell Esselstyn, who's a cardiologist. And what he did is he put patients on a 32 months of a plant-based Mediterranean type diet, very similar to what you see on the right. And the artery in your heart on the left, this is from the same patient. This is the main artery that feeds the heart. And you can see that it just looks narrow and kind of junked up without being a physician. You can just tell that it doesn't look clean. And then these patients went on this diet and the artery looks clean. So it's really, really important to talk about diet when you're talking about reducing your risk of heart disease. It's also important to ask your family members about history of heart disease. So anybody that's had heart problems, age 50 years old or less, you should ask your healthcare provider to potentially test you for an extra marker called lipoprotein little a. So 1 in 5 individuals globally throughout the world are going to have elevated levels of this. This is genetic. And 1 in every 250 people are going to have very high LDL cholesterol, usually above 190, which is very, very high. And that is also genetic. So if you wanted to get more information about those, you could Google it. But a very good website would be familyheart.org, and that's going to tell you a lot about genetic risk factors for heart disease. So I'm going to speed this up a little bit, but again, just emphasizing there's a lot of things you can do with your lifestyle to help lower your risk of heart disease, like lowering sodium in your diet. So The American Heart Association recommends that at least less than 2 grams. The average American has 3,500 milligrams or 3.5 grams of sodium because a lot of the foods that are eaten on a regular basis, breads, pizza, cold cuts, tacos, chips, pretzels, they can have a lot of sodium and you have to be careful about that. Sleep is also very important, especially if you potentially have sleep apnea. So it's important that if your partner is telling you that you snore at night or you're having daytime fatigue or you're not sleeping well, that can impact your sleep risk. And you want to talk to your provider about that. And then stress. I'm talking to a lot of patients lately about, their work stress and, family stressors and social media causing a lot of anxiety and stress. So it's important to kind of take an assessment of yourself and whether these daily stressors might be contributing to your health not being as good as you would like it to be. So I won't read all this, but I did want to mention that why is stress so important? We have this hormone called cortisol. So when you're under a lot of stress or you're not sleeping well or you're sick, your body releases cortisol, which is supposed to kind of help you fight infection and help your body heal. But too much of this cortisol is going to cause you to really gain weight, mostly around the center of your body. It's going to cause your metabolism to slow. It's going to cause a lot of inflammation. It's also going to cause you to be in this constant kind of fight or flight mode with your nervous system where you just always are on edge or your body is always kind of unsettled. So it's really important to kind of address that and talk to your healthcare provider because there's a lot of very good tools for helping to lower cortisol and lower stress and try to mitigate this. So in summary, if you were going to have one takeaway that you're going to hand to your healthcare provider in helping you to prevent heart disease, know what your blood pressure should be, know what these cholesterol tests are. There's really three that are very, very important, which is your LDL cholesterol or your bad cholesterol, your apolipoprotein B or your ApoB, and this lipoprotein little a, which is also called LP little a, which is genetic. Definitely knowing what your blood sugar is. And there's a test called a hemoglobin A1C. It's kind of like your diabetes, your blood sugar report card, because it's an average over 3 months. And then it's also very important to be a healthy weight and a healthy BMI. So all of those things together are going to significantly reduce your risk of a heart attack or stroke if you have good control of all of those things. So in summary, and I'm sorry, I went a little bit over our 30 minutes, but I hope that you have been able to kind of better understand how partnering with your healthcare provider is important because AI is a wonderful tool. I actually used AI to kind of create some of the pictures and some of the material for this talk today, but it does not replace your trusted primary care physician or your trusted healthcare provider. So please, go ahead and Google, but then bring it to us and let us kind of help you better understand it. So thank you so much. And I hope you found this information to be useful.
Well, you're getting a whole lot of love this presentation and enjoyed this in the chat. And our 30
Okay,
minutes is a
great.
guideline, so don't worry about going over.
All right.
Appreciate, again, just such great information. One question we did have back in the chat was about eating the eggs and the avocado. Is there a limit to that? Can I have eggs and avocado every morning? Or should I maybe limit it to a couple times a week type thing? What's your thoughts?
Yeah, that's a fantastic question. And it really depends on other factors because if your body is creating, if your liver is taking that cholesterol in your diet and is creating a lot of those small particles that are high risk, then eating excessive amounts of cholesterol is still not healthy. But if you have a good blood sugar and blood pressure and you're not a smoker and you have a fairly healthy weight, it's absolutely okay to have two eggs a day, 1 or 2 eggs a day, to have an avocado. I love avocados, to have some of these foods. But if you're on the fence about it, talk to a dietitian. I mean, I really give credit to the dietitians that we work with. They're, again, they are very well versed in what the literature is and what the risks are, and they can kind of put the whole picture together for you. But hopefully the takeaway is that eggs and avocados are not as dangerous as probably you thought. So it can be, and the avocados have healthy omega-3 fats and fiber and vitamins. So go ahead and have those avocados.
Excellent. Yeah, the registered dietitians are an awesome resource because they
Yes.
do understand, even they understand what the medications that might affect you, because everyone is unique and individual. So that's awesome.
Yes.
All right, we have a couple more questions here. What are your thoughts on sourdough bread?
Oh, yeah. So that's a complicated question. I love that question though. So sourdough bread, it's more natural than bread that you're having at the store. I'm a little ignorant to sourdough bread if that's whole grain or if you're using flour in the process. So I apologize. But anything you make at home is going to be healthier than what you buy at the store. But if you're using, it depends on the type of flour you're using. So if you're using whole grain flour and you're making it at home, then that's going to have the fiber and it's going to have the, it's not going to have the additives and the negative things that you see in the processed bread. But if you're using regular flour, it's going to have less fiber. It'll have a high glycemic index. So eating a lot of bread may still cause high insulin levels and may make it very difficult for you to lose weight. So sourdough bread will cause less inflammation because it's less processed, but it may still cause your insulin to spike. So what a lot of dietitians will talk about is the my plate method, where half of your plate is vegetables mostly and a little fruits. A quarter of your plate is a lean protein like pork or chicken or fish, and a quarter of your plate is your healthy carbohydrate. So if it's balanced, like if the sourdough bread is balanced with good proteins and lots of vegetables, then that's definitely a healthier alternative. But I wish I could just give you the pass to eat it ad litem. But it's a little nuanced, but it's
Yeah.
definitely healthier.
If you do bake your own bread, you can start with 50-50 of whole wheat and all-purpose flour, and then work your way to whole wheat, just so you can start
Absolutely.
to get your taste buds adjusted to
Absolutely.
that.
Absolutely.
We have a question. I'm going to give you two because they're kind of related. One is,
Yeah.
what can we add to our diet to boost our metabolism? And then what's the one thing we can do or change to help reduce our risk factor? So what can we do, maybe adding something to get our metabolism up? And then what can we do to lower our, one thing you think would be to lower our heart disease risk factor?
Interesting. That's interesting. That's kind of a tough question because I know that they, when you're checking out at the grocery store, they want you to buy that magazine. So they're going to say that certain foods are metabolism boosters, right? Metabolism is a complex thing. Your metabolism, your body has a certain metabolism. And so when you're eating a lot of sugar or refined carbohydrates or high glycemic foods, you have these spikes and then quick drops, and you have a lot of insulin. So that is a very negative thing for your metabolism. If you want to stabilize, if you want to have better metabolism, a lot of times that has to do with stabilizing your sugar level in your body and stabilizing insulin. So that means that you get away from the refined grains and sugars, that you add more fiber, that you regularly have healthy sources of protein. But there is some research to show that the order of the food that we eat is helpful. So if you try to eat your protein or your vegetables before you have the carby thing, like let's say you have chicken and rice, try to have your chicken before the rice, because the chicken is going to stabilize your insulin so that when you have the rice, it won't have such a negative impact on your sugar and your insulin. So trying to be thoughtful about your food order and making sure you get those veggies and protein before you eat the carbohydrate could also help your metabolism. And I'm sorry, what was the second part of that question?
What's one thing that you would suggest for decreasing our cardiac risk factor?
Oh gosh, that's
It's just
one
a
thing.
simple thing. Come on, one quick thing.
Yeah, diet, diet, diet. Don't be afraid of medications. I think there's a lot of misinformation about statins out there. Statins save lives. There is a lot of very good evidence to show that medications like Lipitor and Crestor and others are life-saving medications. So you want to work with your healthcare provider on that. But if you're going to lower your risk of heart disease, it really is, there's several big things that you have to work on. One of them is sugar. So that's why I wanted to talk about how it's not just about cholesterol. Having pre-diabetes or metabolic syndrome or obesity and having high sugar or high insulin damages your arteries. So your sugar needs to be good. Your blood pressure needs to be good. High blood pressure all by itself can cause heart disease. If you can never smoke, don't smoke, because that accelerates your heart disease risk 10 times more than the general population. And then finally, your cholesterol, looking at that LDL, the ApoB, the lipoprotein little a, that's an important part of the story and should be managed with medication or diet or a combination of both. But you really can't look at one thing because all four of those big things have a significant impact on heart disease, on stroke, and newer evidence is saying Alzheimer's disease and dementia. So all of these things are very, very critically important.
I do think just reading literature, the word inflammation comes up so much. So if you can be doing anything that's going to help to decrease inflammation, whether it be your food choices, sleep, exercise,
Yes.
it is a combination. There is no one single bullet. I think that's as I chuckled as I asked you, what's the one thing? There is no one thing, and each of us are so unique. But what I am hearing you saying is be aware of what you're putting into your body, be aware of what you're doing. Make sure, even if you're Googling things to find out information, you're having those conversations with your trusted provider because they know what's going on. They're looking at the blood work also.
Yes.
And between the two of you, you can start to have that meaningful conversation as to what's best for you. And then maybe bring in other people to the team, like the registered dietitian or a physical therapist or someone that you need to help you to get to that next step. And I think that's from listening to everything you said, I kind of
Yes.
heard that flow through there. And I think that's an awesome message to be
Yeah.
sharing.
Yeah. And it's not that supplements and other, juicing or whatever the thing is that you want to try to do, it's not that that wouldn't be helpful, but you have to do it in the context of everything else. Because if you have a bad diet and then you take curcumin, which is a supplement that's good for lowering inflammation, but you're eating a very processed diet or you're smoking or you're not exercising, that curcumin is not going to do anything. It's not going to do anything. So you really do have to work with your dietitian, your family physician, your healthcare providers, because we're looking at all of you. We're looking at all of you, and we understand the impact of one thing and another thing. So you really do have to look at the whole person, and that you have to tailor it to that one person. So yeah, absolutely, you have to look at the whole thing.
Excellent. Thank you so much for all of your time that you spent with us today.
Yes,
We have
absolutely.
recorded this video. In fact, I'm turning it off now, but this will be up on our BayCare Presents site in about 3 weeks it takes.